Welcome to From Healthcare Disparities to Health Equity. I'm Risa Lavizzo-Mourey. I'm a university professor with appointments in health policy in the Perelman School of Medicine, healthcare management at the Wharton School, and family and community health in the nursing school, and I'm going to be your instructor. In this introduction to the course, I'll tell you a little bit about myself, explain the objective of the course, and then give a high-level description of the content. Like many of you, I have experience outside of academia. Specifically, I spent roughly 15 years as the president and CEO of the Robert Wood Johnson Foundation, an $11 billion foundation focused on improving health and healthcare and building a culture of health in this country. My goal is to bring that real-world perspective to the course, and I encourage you to do the same as we use case studies and policy analyses to explore health equity within the context of population health, the social factors that influence the health of individuals and populations, and discuss strategies for improving health equity. It's been estimated that the excess healthcare costs associated with healthcare disparities is $30 to $35 billion a year. So now you know a little bit about me and the objective of the course. So let me turn to the content. I will rely heavily on reports from the National Academy of Medicine in presenting this material because the Academy's rigorous in applying the best evidence and includes perspectives outside of healthcare and is pragmatic in the policy approaches. And similarly, the readings are a mixture of original articles and reports that synthesize the literature and make policy recommendations. The real goal of the reading and the viewing of this material is to be able to interact with your colleagues through online communications in ways that allow you to test your knowledge by examining the principles in your personal and professional lives. The lectures are guides, but the real learning will come from your active engagement with the material and your colleagues. Remember, my goal is to help bring the knowledge of the literature and your real-world practical knowledge to bear on thinking through innovative approaches to reducing disparities and promoting health equity. You should plan on spending less time watching lectures and more time actively researching and applying the concepts in ways that are relevant to your situation. I've tried to keep the required readings to a minimum and provide a robust selection of suggested readings and videos for you to use in your active learning. Ideally, these suggested readings will help you tailor your explorations to areas that are most meaningful and relevant to your professional situations, and then give you the tools to promote health equity where you work and live.